Good morning, everyone. I'm Megan Cullip, along here with Scott Micklin.
Good morning, Megan Cullip. Good to see you.
Scott Micklin.
Happy Monday.
Happy Monday.
It is Monday, July 13th. Here we are.
Here we are.
Week number, I don't know.
I think we're in like 18.
18. If you lost count, because if you've lost count, then there's no hope for the rest of us.
Yeah.
Oh, dear.
I believe it's 18, though.
18.
Yeah.
All right.
It might be, yeah.
Old enough to vote. There you go.
Quarantine is now, it is voting all over the place.
Right.
Right and left.
There you are.
Yes.
Well, great. Well, it's good to be back.
Yes.
Monday on our COVID-19 local information program. And here we are. Thank you, everybody, for joining us, by the way. And we're glad that you are with us as well. And here we go. Another week.
Here we go. Another week. That's right.
So we have changes today, of course, with the governor's health order.
Right. The changes are...
Restaurants go back to...
Yes.
They can dine on patios, outdoor dining at 50%.
Right.
Or curbside or carryout.
Correct.
Is the new change.
That's right. So it seems like every press conference, it's really just a commentary on breweries and restaurants.
Well, that appears to be what the data is showing where some of this might be spreading. So I think that's
for certain spreading.
The problem. And with the numbers in our state, which we're going to talk about in just a few minutes, that's the concern.
And also... football in the fall, not a thing anymore.
That's true. Fall sports, contact fall sports have been postponed till the spring.
At least,
right.
Yes.
And so I was talking to some friends over the weekend, and they were thinking that maybe some of the spring sports may get moved to the fall. Like maybe tennis.
We have no idea.
You know?
Tennis, I think, is low risk comparatively, of course.
Oh, yeah. I would think so. And
Do
even,
we have a hockey team in these parts? Probably not.
I don't think so.
It's a little
I think
Jamaica bobsled team situation.
You might find some hockey in Durango, but not here.
Right, because if I hear contact sport, and that's what I think, because they're like beating each other up out there.
Right.
Out there on the ice.
They have a lot of masks and stuff, don't they? All the protective gear in hockey.
Yeah, but the mask it's not like a
solid mask. Right. Okay.
It has holes.
We'll do some more research on that, everybody, and
we'll
get back to you on that. Exactly. But anyway, we do have some numbers.
Yes.
To share, right?
Yes.
So as we go to our
pulling up the
graphics
national numbers
and things. Yeah.
Cool.
We could.
Okay.
Because we're looking at Johns Hopkins, right?
Correct.
Oh, you know what? Before we do that, I'm sorry.
What?
I'm going to talk about testing this week.
Okay, yeah.
Because we did have that. So let me show that to everybody. Testing today at Salmon College, just wrapping up at 9 o'clock this morning. Tomorrow I'll be back here at Salmon College at 7 o'clock, 7 a.m. to 9 a.m. Tuesday, also in the evening here at Salmon College from 6 p.m. to 7 p.m. And then Wednesday at Judy Nelson School from 8 to 9 a.m. And then Thursday back here again at Salmon College, 7 a.m. to 9 a.m. So I did want to point that out. So this is again from the New Mexico Department of Health. And they ask you to pre-register before you show up to be tested. But again, we are, the state is trying to ramp up testing to kind of see where some of these outbreaks are. I think from the governor's press conference that we mentioned last week, Northwest is looking really good compared to other parts of the state. We're looking at you, Las Cruces, but they were having a hard time.
Don't shame our
Their numbers
neighbors.
are going up, and so we had such a hard time of it for so long.
We did.
I think it's nice to celebrate that our numbers are maybe more in control than other parts of the state. So there's that.
Good for us.
Yes.
For now.
Yeah, that's right. But that's it.
Snapshot.
You kind of have to stay on top of it.
You got to stay
vigilant.
vigilant.
Or else you become another Florida or Arizona.
That's right.
And I think that's the issue. All right, here we are now with national Johns Hopkins numbers.
That's right. So as of Sunday night, 3,302,695 cases of COVID-19 have been reported in the U.S., which is an increase of 56,770. And 135,176 deaths have been attributed to the virus, which is an increase of 399 from yesterday, leading to a mortality rate of confirmed cases of 4.1%. And of the, listen to this amount of tests, 40,282,176 tests conducted in the United States, 8.2% have come back positive.
Wow.
Yeah, that's 399 deaths in one day.
Yeah, that's, I'm afraid, a horrible record. But
yes.
Yeah, true. And by looking at the map we're displaying for our viewers, again, this is the Johns Hopkins dashboard, and it shows you the top 50 confirmed cases by county, so the higher counties. So Los Angeles is up there, Cook County, which I believe is Chicago.
Is it? There's also one in Tennessee, but I'm pretty sure that they're talking about Chicago.
I'm going to say
Yes,
Chicago.
yes.
Yeah. Maricopa, which is Phoenix.
Okay.
Queens County, which is a borough of New York City.
Sure.
And Miami-Dade, of course, which is Florida.
Sure.
So we've seen Kings County back in New York City. So we've seen, again, the New York numbers are kind of coming down. Counties, not so much. Florida numbers are back up. Arizona numbers are up. So that would be the reason why you've got Maricopa up there as well. And then the other side of the graph are the number of deaths, and you can see Queens and Kings in New York City, the Bronx, and Cook County there, Chicago as well. So there's that.
Got it.
Yeah. So there you go. As we move forward, we can show you in New Mexico. Again, here's the dashboard in San Juan County. And again, we're now at 2,711 cases. This is from the Department of Health. Total deaths reached 171 in our state. Recoveries in our county, 1,508. And total tests given out in our county is over 26,000. So that seems like a significant number, but of course we know we have about 120,000 people living here.
Correct.
So.
And correctional facilities, no new cases.
Correct.
There you go.
So that's good, because I know we've had some issues at the detention center.
Correct.
And then this is an article that you shared from the New York Times about testing. And
right.
We have seen New Mexico as being green in some maps on how we're dealing with this outbreak, but when it comes to testing, at least according to data that the New York Times is coming and showing us, is we're still not doing enough testing. Is that what that shows us?
That's what this graph shows us. Yeah, it's how well each state is doing relative to population and amount of tests. So the green states, Alaska, Hawaii, Kansas, Wyoming, West Virginia, D.C., New Jersey, New York, Massachusetts, Connecticut, Vermont, and Maine. And then most everybody else in the United States is red.
Right.
So
interesting.
There's 4 states there that are kind of in the middle. But
yeah, here's the article. Basically, 12 states are meeting the testing target, 4 are near, and 35 are below. That's what we're seeing on this map as I scroll down. And so New Mexico is not meeting the target. As we keep scrolling down, we can see exactly where we are on the map. So, again, percentage of testing target, a daily test per 100,000 people. So again, Arizona is kind of at the top of the worst, right? If I'm looking at that correctly. If we scroll down, we can kind of see that New Mexico is actually towards the bottom, which means we're getting there, right? We're trending up, as you can see there. So we're at 262, and so we're in the green, and our tests are trending up, is what I interpret that as.
Yes.
So that's good.
That's good.
And we're heading in the right direction. So
correct.
Very good. Let's go to the phones.
Sure.
For our first guest this morning. And good morning. You're on KSJE. Thanks for calling in this morning.
Hey, good morning, Scott. This is Jeff Bourgeois. How are you?
Hey, Jeff Bourgeois. I am well, thank you. Jeff Bourgeois from San Juan Regional Medical Center. It's great to have you back on the air with us, and thank you so much for calling in.
My pleasure.
What is the latest that you can share with us from San Juan Regional Medical Center this morning?
Well, one of our routine section leader meetings is going on right now at the hospital from our incident command, the daily update that the team members provide. Right now, we have 26 total COVID patients in the hospital. Only 3 of those are intubated, and only a total of 5 are in the ICU. So that it's been interesting for us to watch this, Scott. While the number of hospitalizations is still, pretty active, that number 26 is still less than half of our peak, which occurred back on May 15th. And it seems to me that we have a little lower acuity right now, as noted by fewer patients in the ICU. But still, the virus is very active in our community, still creating at least enough of a need for 26 patients to be hospitalized today.
Interesting. Okay, and so and compared to other weeks, Jeff Bourgeois, I mean, is this about on target from what you've been seeing, or how is this, or is this different? I know you mentioned you only had a couple that were intubated, but but that seems less than before to me.
It is, and as I mentioned, only 5 of our COVID ICU patient beds are occupied at the moment. So we have a lot of ICU capacity and that's a much better circumstance than we were 2 months ago back in May. It's really hard to predict what's going on, Scott, to be honest with you. We're watching the percent positive rate, the percent of patients that are tested that have a positive result. That has climbed back up above 10%. We look at a 14-day rolling average just to try to level out peaks and valleys when you might have some days where you do a lot of testing and other days where you don't. But for our results, we're seeing right now, again, on that 14-day rolling average, a little over 10%, which has shown an increase over the past week and a half. That's usually a leading indicator, if you will, of what might turn into hospitalizations later. But it's really hard to tell. It really would come down to detailed analysis of what patient population is being tested, what age are they, what underlying health conditions do they have, et cetera, to determine if that would really convert to hospitalizations.
Sure.
Statewide, what we're seeing is a really high demand for testing. Down in Albuquerque, I spoke to some of my colleagues earlier this morning down there, and they're seeing people line up hours in advance of public testing offerings. And some of the Department of Health sites down there are testing 200 patients an hour, and and that's why you'll see, particularly in Bernalillo County, really high numbers of new cases being diagnosed because of the really expanded testing that's going on.
Right, and we're seeing that we just went over the schedule this week here, Jeff Bourgeois, for testing for folks who want it, and it seems like, again, the Department of Health is really trying to offer this and across our state to really anyone who wants to be tested, which has to be a good thing, even if it uncovers more positives, right? You still want to know where these things are and where these outbreaks may spread, correct?
Yeah, I would agree, Scott. I think the state needs to be commended for offering increased access to testing. That just helps us understand more about the prevalence of virus spread within any given community, and I think from that information, then public health policy is at least partly determined by virtue of those results.
Indeed.
It also obviously gives the individual knowledge about their circumstance if they were concerned if they had exposure or not.
Indeed. And I was going to ask you too, Jeff Bourgeois, about we've seen I saw some articles over the weekend a little bit about when folks talk about the number of fatalities from COVID-19. That is one statistic, of course, which we certainly can see, but people are not talking maybe about the survivors of COVID-19, but some of the long-term health effects that it has on them as well. We're grateful and happy that they have survived, but I think we sometimes forget about some of the other health effects that this can cause to the body, and that's something we should keep in mind, is it not?
It is, and I think that the interesting thing to me about that, Scott, is certainly, particularly if you've had a difficult course of illness with a COVID-19 diagnosis, we really don't know what the long-term impacts are going to be yet. This is such a new virus to the medical community, but there are concerns about long-term negative implications for your respiratory system, particularly your lungs. But I think we're going to need to continue to keep an eye on the medical literature and research that comes out of this pandemic to really understand what the real results from a long-term survivor perspective will be.
And Jeff, I had a question about the hotline because I saw a number over 2,000 plus people have been using the hotline. So clearly it's something that you guys are still using. And what are the hours again on when people can call that hotline?
Well, Megan, first I want to make sure that we let me get back to my computer, but I want to make sure we let people know that the state still has their hotline available. I would call all your listeners' attention to our website and to go to if you will bear with me.
That's all right, Jeff Bourgeois. That's all right.
We have a COVID and coronavirus portal on there, and that's what I would really direct people to.
Right, and we are calling that up on our side too.
Yeah,
and that's where folks can go. Again, SanJuanRegional.com, everybody, to check that out. Your COVID-19 information program. It talks a little bit about some of the news that's been there, your visitor policy and things like that is what I'm seeing on the website here, Jeff Bourgeois.
Yeah. Thanks, Scott. And I do want to mention that a couple of weeks ago we did loosen up our visitor policy a little bit to allow for some visitors for non-COVID patients. One patient per day per patient, one visitor per day per patient with a 9 a to 3 p.m. window of visiting hours there. It's really something we are watching what happens across the state and trying to stay consistent with what hospitals in general are doing, because that's our community of hospitals within the state that help us understand what is generally accepted best practice at this point.
We're seeing, speaking of visitors, we're seeing something on the webpage about e-greetings. Tell us about that.
Well, there's just an opportunity, multiple opportunities actually, to stay in contact with a friend or loved one who's hospitalized. Of course, through Facebook and all the other social media platforms that people may have, if they have access to them on their phone or other electronic devices. And then an e-greeting can be something that is sent via the website to a patient.
Very good. Well, it's one way to keep in contact, as you mentioned, Jeff, and let folks know who are in the hospital that they're being thought of by their friends and family if they can't get there to visit, because we understand the policies and things like that. So we appreciate your time of calling in this morning. And again, thank you. Please extend our thanks to you and all the staff at San Juan Regional Medical Center who are really on the front lines of this and keeping those patients safe and hopefully on the way to health again. Thank you.
Thank you, Scott and Megan. Appreciate what y'all do and allowing us to have an opportunity to update the community via your show. We really appreciate that.
Well, we appreciate you coming on, and the doctors that come on too, Jeff Bourgeois. Thank you for all their time that they spend with us. So have a good week.
You bet. Take care.
Thank you. That is Jeff Bourgeois. He is the CEO of San Juan Regional Medical Center, joining us this morning on our COVID-19 program. So there
helpful
you go.
Updates.
Very helpful. That's very true. And we have another guest.
Yes.
So should we go to the phones?
Yes, let's do it.
Keep going to the phones?
Uh-huh.
The phones are getting a workout this morning. I like it. It's a good thing. Good morning. You're on KSJE this morning. Thanks for calling in.
Hello, this is Suzanne.
Hi, Suzanne. This is Suzanne Seitzinger, if I pronounced that correctly, right?
You did.
Thank you. San Juan County Shelter Site Coordinator, and we appreciate you calling in. Thank you very much.
Well, thank you for having me.
You bet.
Yeah, so the reason we reached out to you is we've heard a lot of stuff about the risks involved in congregate settings, which of course includes shelters. And the emergency management guy, Mike Mestis, informed us that you are working on procuring donations for non-congregate shelter settings. So can you tell us a bit about that?
Absolutely. So San Juan County currently has two shelters in place. So the purpose of this is if there is a person that either tests positive or is awaiting their results, they live in a congregate, either shelter or home, and they can't self-isolate, then their medical provider would refer them to one of our shelters so they can safely self-isolate and self-quarantine.
Great. And so have these shelters, is this a new thing or is this always going on and we're just now becoming aware of it?
So I came on board about approximately 2 months ago. So they had just started maybe a month or two prior to that. So it's fairly recent. We're just trying to get everything up and running very smoothly.
Interesting. And so, Suzanne, what can folks do to try to help? You're looking for donations? What types of things do you need?
Absolutely. And San Juan County has been gracious, and I appreciate all of their support. So some of the items that we do need: toothbrushes, toothpaste, razors, shaving cream, clothing items, all sizes, all genders, snacks, books, puzzles, gift cards would also be helpful. So if one of the residents needs some Alka-Seltzer or Tylenol, then I can actually go get that for them. So we just want to make sure that they're staying safe in the shelter and that they have all the items that they need. If you can imagine being stuck in a hotel for 10 to 14 days, if not more, that could be kind of boring.
Absolutely. I would go mad. I'd go crazy.
Right.
So when it comes to, because of the times we're in, when it comes to clothing donations, you're talking about new clothing that we should bring, right?
New clothing would be greatly appreciated.
Okay. Good to know. And so we can drop this off where?
So I would say contact me, and I can give you my cell phone number. And that way I can coordinate days and times to pick up the items being donated.
Sure.
That way we don't have a bunch of people. We make sure everybody's safe.
Okay. If you don't mind sharing your cell phone number.
Yes. It is 505-320-0514.
Okay. That is 505-320-0514.
Yes, sir.
All right. Very good, Suzanne. And again, you've got the locations that you need, but you're looking for more donations of either cash or clothing or these toiletry items or things like that.
Yes, sir.
Okay. Very good.
Anything is helpful.
That's what it sounds like, yeah.
Right. And I get and would this also impact children, or are we just talking about adults?
So this does impact children. So the rules for children going into the shelter sites, they do have to be accompanied by an adult. We haven't had many children, but we have had some. And if you can imagine, a 6-year-old in a room for 14 days, yeah, we need some coloring books or something to keep those kids busy.
Very true. Okay. Well, good to know. Well, we appreciate you calling in to share this information with us. This is another way that our community is reacting to help those that are being impacted by COVID-19. And I think it's a great thing to be able to offer that to folks, to be able to be safe
Absolutely.
For that 2-week period while they figure out what's going on.
Yes.
Very good.
And thank you guys so much. I appreciate it.
You bet, Suzanne. Again, thanks for calling in. Your phone number again for our radio listeners, 505-320-0514.
Yes.
All right. Well, take care, and please call us back with an update maybe in a couple of weeks.
Oh, absolutely. Thank you so much.
All right. Thank you very much.
Okay. Bye-bye.
Bye-bye now. That is Suzanne Seitzinger. She is a San Juan County Shelter Site Coordinator joining us this morning.
Yeah.
So, first time we've talked to her.
Yeah, that's the first time we talked to her.
But, this is the way the county's responding, and that's great.
That is great. Last thing you want is to take somebody already sick and throw them in a congregate setting.
Right.
Just keep
that doesn't
circling around.
It doesn't help things, does it?
No.
So anyway, we were talking about the New York Times article too.
We were.
Right. So there was that, and then we didn't talk about we talked a little bit about the local numbers.
We did.
Didn't go to the website, but
Correct.
We can do that.
The Department of Health, we just pulled that up.
We showed those. Yeah, exactly.
So
then we're caught up.
Lots of numbers. Yeah, so I think we're caught up.
We're all numbers, right?
We're all numbered out.
We are. That's true.
But so, again, you can find the national numbers on the Johns Hopkins University dashboard. You
That's
can
right.
find the state numbers on the county website or the Department of Health website or our website.
That's true.
And you can find the San Juan Regional Medical Center numbers
on their website. That's very true. So again, and then testing, again, as we mentioned, testing's ramping up all over. And here we have the list here. It's in San Juan County this week. And again, in the past, they've done it, I think, in Kirtland twice a week. It's only going to be on one day this week, on Wednesday. And then Monday, Tuesday, and Thursday here at San Juan College, which they've got. It looks like a pretty effective and efficient method, because you went through it.
Yes, I can confirm.
A week or so ago.
Yes, register ahead of time. That's a necessity. And then that helps them when you pull up, they take your name, they radio it to the people further down the line so that by the time you get close to the tent, they have your biohazard bag prepared.
Ready to go.
Just for you.
Just for you. I gotcha.
Yeah.
And so
My germs alone.
there wasn't a long wait necessarily, was there? When
It wasn't
you
that
were
bad.
there?
No.
Okay. You were there in the morning?
No, I did an evening one.
One of the afternoon ones. Okay. Gotcha.
Yeah.
So there you go, everybody. But again, I think it's, again, very important to, if you're not sure or want peace of mind, to get tested. I think they're advising that really it's open to anybody, and it is no charge. We've also, of course, talked about the other urgent care in town at Browning Parkway and Main Street that is doing testing as well. And so that they're every day, I believe. And so it's, again, if you have insurance, that's a no-cost test as well.
It's actually a no-cost test. Well, the public health ones are no cost for everybody.
Right.
Yes.
That's my point.
Yeah.
But if you have insurance and you could go to the other place, it'd still be no cost.
Right.
So
Right.
there's that as well. But
yeah.
But I think, again, our state has really tried to get these rolled out, and they're really trying to step up testing to really try to track this. We can see what's going on in our neighboring states, Texas and Arizona, some of the outbreaks in Florida now. I think there was most cases ever even higher than New York at its peak in Florida.
110,000.
Over the weekend. So so that's what's getting a lot
in
of
one day.
News. Yeah.
Yeah.
And, of course, New Mexico is trying to keep it under control.
We are.
And with those other public health orders this afternoon, they're going into effect today, with, again, the restaurants. And our heart goes out to those restaurants. But I think, nobody would want, no restaurant owner, I can't imagine, would want an outbreak at their facility from a diner.
No.
So I think that's really what you have to keep in mind. So,
right.
Anyways. So with that, I think we've wrapped up for today. We've shared all this information, which is what we do.
Which is what we're supposed to do.
That is what we're supposed to do.
Some information, not just yammer.
No,
half an
we
hour.
do that too.
We do a lot of yammering.
We kind of do.
But I think that balances out.
Right.
We've heard from our
There's a mix.
listeners, I believe.
Whatever that formula is.
The pie chart of yammer and news.
Right. There it is. The yammer pie chart.
We got to find that dashboard.
I'm sure someone
we got to add it.
Yeah, there'll be a dashboard for yammering and information.
Yes.
But there you go. But everybody will be back on Thursday. So again, the show is on Mondays and Thursdays. Again, 9 a.m. live on Facebook and YouTube. And of course, on the radio every day at noon, of course, on on KNMI at noon, and on KSJE radio at 5 p.m.
That's right.
5:06 p.m. So that's where you can hear it as well. So please
right
share
after
it.
the BBC.
Right after the BBC, exactly.
Look at us.
And they're yammering.
They're yammering
with an accent.
With an accent.
That's it.
They yammer and it sounds all dignified and
Right.
with the Queen's language, and then we come on and we yammer.
That's true.
And it's not as dignified. But they're the headliners and we're second in command. How cool is that?
Okay. I don't see us as second in command.
Okay, good point. Okay, fine.
I think, yeah.
We're both headliners in our different ways.
That's right.
Yeah.
There you go. Just look at our Facebook pages.
That's right.
There
Oh,
you go.
my goodness.
There you are.
Yeah, look
All
at
right,
Scott
everyone.
Nicklin's Facebook page.
Okay. Yeah, and yours.
Mr. Vanity over there. It's fun, though. It's fun. Everybody likes it.
Okay.
Yeah.
Oh, that's important.
It's not like that, like, ew, this guy is so arrogant. It's like, ha, 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 ha.
Oh, I see. Okay.
Yeah.
Well, now, there you go.
Yeah.
It's Megan approved.
Yeah,
I'm going to put a little stamp on there.
2 thumbs up. 10 out of 10.
There you
We
go.
do again.
All right.
Okay.
Testimonial. You heard it here first. All right, everyone. I think we're done.
Yeah,
I
we're
think we need
totally
to stick
done.
a fork in this
Okay.
show.
Jump
Yeah.
the shark.
All right. Thanks for joining us, everybody. Have a great Monday. We'll be back on Thursday at 9 a.m. right here on KSJE. Take care.